Let's go ahead and get Lieutenant Governor Josh on the show. Thanks, LT, for joining us this morning.
Hi, good morning. Hi, Chris and Sabrina.
Good morning.
People of Guam. Good morning.
Good morning. I guess we haven't talked to you since the oversight hearing. Kind of just, if we could just give you the floor and get your thoughts on that hearing.
On the oversight hearing?
Yeah.
Well,
I mean, you did, when we first interviewed you, you did say there were some red flags with the procurement.
So, I guess I would say that, as I'm not mistaken, today, the auditor's office kicks off their audit on this procurement, and I'm hopeful, or I would expect that all of the things that people did and what they knew and what they're saying should all be documented, and we'll all have a chance to take a look at it and, I guess, sort it out that way.
Mm-hmm. Did you hear Senator Tello Taitagui on the air? She was mentioning that Hai Hin, when he was at the oversight hearing, he read a statement, I believe it was from the governor, and it basically sounded like the reason why he was directed to take over the whole procurement for the quarantine hotels was because the HSA director had basically dropped the ball. So he was told to go in there and get this done. And so he did. But Senator Taitagui, the minority leader, was saying that she received a message from the HSA director saying that was absolutely untrue. And then he deleted his messages. Why, of course, we don't know. What are your thoughts on that? And is that true or it's not true from what you know of what happened here?
Well, I guess for me, what I'm thinking is I'm going to look at is what the audit says, but I just say that I did get a similar message from the HSA telling me the same thing and expressing the same sentiment.
LT,
and
what?
So,
go ahead.
Go ahead.
Mm-hmm. What did you make of the use of the executive privilege? I'm not really asking you to break from the governor on this, but I thought it was interesting, and I don't know.
Can you repeat yourself?
Yeah. What did you make of the governor or the legal counsel's and the governor's use of the executive privilege? I don't know if you know, they sent a letter down to the legislature an hour before the hearing and said they won't be waiving executive privilege, and I can't remember if that's ever been done before, but I thought it was pretty interesting, especially for a process that they had held up that, hey, we use these powers, we own it, we think it was okay. So I just was curious, what do you think of them not really answering a lot of questions on it and reading the statement and, using the executive privilege?
Well, I think when you're dealing with lawyers, I guess it gets a little complicated sometimes. And gosh, I don't have a comment on the executive privilege yet. I'm still kind of processing that in my mind. Mm-hmm. I've been reading up on when it's used and why it would be used, and our councils are recommending that, and I really don't have a comment on that yet.
Mm-hmm. So what part, I wanted to go back to Tim Elgin because I'm not done yet. What part did he say was not true?
He just indicated to me that, he was not instructed to do any procurement. That's pretty much what it was at the time when they were doing all the planning.
Did you hear anything at all about...
Wait. He was told that he was not
he wasn't
instructed to...
What he messaged me was that he just wanted me to know that he was never instructed to initiate procurement during the time in which he was working with public health and GHRA. He was simply trying to understand which hotels would be willing to step forward and voluntarily be considered to be used as quarantine. That's what he told me.
Mm-hmm. Right. So if he's not in charge of procurement, as the Homeland Security Administrator, who is during a public emergency?
It would be. Civil Defense should be the purchaser.
Civil Defense would be the one who would be going out there and trying to find the
facilities.
They would coordinate, just like they're doing it right now for quarantine, what they did recently for quarantine, and also what the active procurement is for the homeless shelter.
And the HSA wouldn't have anything to do with any of that?
Yes, of course. But what he's trying to tell me is that at that posture that he was in, he wasn't initiating the procurement. He didn't. That's what he told me.
Did he say he had anything to do with this
Sabrina,
condemnation?
I'm learning also. I'm trying to keep an open mind. I would like the audit to take a look at it, but I don't want to be, I just think that the fair thing to do is I would like the independent auditors to come in, issue a report, and I want to take a look and see what happened.
That's
I don't want to make allegations against people. I don't want to defend people if I don't know the whole thing and I'm not involved in the transaction. My interest is I want to see once the independent auditors are there, what happened and what needs to be done to improve the process. The same thing that Senator Sabina said at the oversight hearing is this is the first time we had a pandemic, and if the system could not be relied upon in time to secure the hotel, or if there should be a better way, a method, and I'm interested in kind of understanding that and doing the change or the improvement.
No, I understand that this is the first time we've had a pandemic of this kind, but at the same time, does that make it okay to pay invoices and pay people without signed agreements, without following procurement?
And
or we're
what I
okay
think
because, I have special
Sabrina,
powers?
I think that the audit is going to tell us what was appropriate and what was not appropriate, and what should have been done or what should be done. That's what I'm expecting that process should be from people that, from the independent auditors. That's what I'm looking for.
Independent audit. So who picked up these independent auditors? Are we talking about the OPA?
No. Yes, the OPA. The OPA. There's a, if I'm not mistaken, they're initiating or their kickoff for that audit. The review of CARES Act, the review of pay is all starting up today.
So you were a former GAR. Is this the sort of process that would have been followed? Or would you have signed?
A typhoon, we never experienced it like this, where we had to shut down and prepare for the threat of people coming in from a country that was closing up. I mean, I think that's really just taking a look at what the timelines are and whether or not the decisions that were made to secure the facility are the best decisions that were made. And the auditors that I saw is also reviewing and determining which statute was relied upon to obtain and complete this transaction.
Yeah,
that's what I'm looking for.
I think LT. I mean, if you look at the timelines of it, it just doesn't add up, because they're now saying, "Oh, we were going to use CARES Act funding," but that seems to have been a determination that was made after the fact, because as we all know, in following this, they went out, they did it. They tried to give it to Claudia Faggi. She said, "I'm not signing it. You already paid invoices. I don't want to get in that mess." Charles Estevez also did not sign it. And it was then that they said, "Oh, we're going to," I mean, I guess the only thing they had to fall back on was the Emergency Health Powers Act. So I think that timeline's important, in that they had tried to, even though the governor's legal counsel was out there making deals, they had tried to ram it through the existing process we're all familiar with. And when the people who are a big part of that process and the approval said no, then it was, "Oh, let me do a memo and, Ed Byrne, pay this stuff." So I think it's interesting that the timelines of it, because although they're saying that they're using the CARES Act funding, we know that there was an attempt to get it finished anyway with the traditional emergency procurement route.
And even after receiving
and that's how I think that's what we're going to see laid out, I believe, in the audit.
After receiving that message from Tim Uggan, did you do anything with it? Did you say, "Hey, Governor, I just got this from the HSA, and he said that that statement was not true"?
No, he just spoke to me on Saturday, and he also has a sick relative he's caring for, and I wanted to reach out to and talk to him about that, but.
So after you spoke with him on Saturday, did you bring it up to the governor or
We
Mr.
haven't
High?
spoken about that yet.
No. Okay.
Yeah.
I also got some text from Tim Uggan. I think he was texting everybody. I think after that hearing, he was like, "Ah, hell no." But the gist of the text I got was that he was telling me he's nobody's fall guy, and he won't tolerate anyone trying to discredit or accuse him of any wrongdoing in public, especially in the media. So that sounds pretty firm.
Yes, it does.
Yeah. So this is going to be an interesting one to play out, LT. Are you social distancing from this?
No. I'm just trying to keep an open mind and trying to understand and see how all of this was pieced together.
Yeah.
And understanding that, I still don't believe anybody was acting malicious, but I would like to, I think the audit is going to let us know what the path to obtain the service should be or is. So I would like to see the whole picture.
Mm-hmm. Well, let's move on and let's talk about the economic recovery and tourism potentially reopening in July. And there was something that you had said during the press conference when former Governor Carl Gutierrez was there, and you said something about let's make lemons, right, or lemonade out. Lemons out of lemonade, right, or something like that?
I like to make Finadeni, but
I used to work for him, so I used to say that all the time.
Right? Yeah, you did. Yeah.
But of course, we're watching the situation. I've been reading with very keen interest the situation in Korea, where they're closing schools again because they're trying to understand what these clusters are. And so obviously, there's a whole lot of people on the island, both in the industry and in the physicians advisory group, that are really trying to analyze and develop the best possible strategy to facilitate the return of the tourists. Mm-hmm. And on the other side, it has to do to make sure that we have a good, robust response. And I'm thinking that it's going to spark at least some innovation. And this is also interesting because even testing right now is just such a dynamic situation where there's a split in the medical community about confidence level for the serology tests, the blood tests, and there's legal side whether or not you can mandate people to test, or is it the airlines that can mandate, and what the role of government is. There's a lot of stuff that I think is being sorted, but we have some good minds on it. And I'm also grateful that Jerry Perez has lended his time to help stabilize and find a good path. And I'm optimistic that they will. The other side of it also is working with the schools. And we've been doing a lot of work in the last few weeks, understanding the digital network on the island, and very fortunate to have really good connectivity on the island because of all of the undersea cables that are coming in. And so right now it's really about understanding what DOE's future is and the other schools, and how we can provide support for the kids to get access home. Because I think that right now, based on the social distancing rules, it still has to be determined what the occupancy is going to be in schools, and that's an active, unresolved issue right now.
Right. LT, what did you make of this, the news coming out of South Korea, which is one of the markets that we were targeting? They reopened a bunch of schools, then had to shut them down because of a surge.
Close them.
Right. So
I think that is helpful. It's unfortunate for them for sure, but it's helpful for us to make sure that we continue this posture of slowly rolling things out and making sure that it's in line with what the capacity is at the hospital. Those are, some of the things, and then making sure that we have continued support, including from the military, with all of the the facilities and the personnel that are here to support the posture.
Right.
Right.
One of the, I'm not sure, and I think because we're really in the thick of things, but the Army general that came out and that will come out if there will be a surge is actually a Chamarita. Did you hear this?
No.
General Smith, and she is an Artero. Her professional background basically is running military hospitals, and she was one of the people out of Hawaii that was sent here basically to do the assessment to facilitate the opening of that field hospital, but then also to open pipeline for some medical folks. So we have microbiologists that came in from the military that are with the CDC folks and public health folks at our labs, and things like that. But so it's those are resources that we definitely want to continue. And then of course I do want to thank all of the doctors in the physicians advisory group. And also the clinics. I read the story over the weekend, and I just wanted to maybe address this whole issue with the payment of the Tier 2 clinics. And
Thank you, LT.
what's happening is trying to come up with a good approach that is based on some consensus, because we have also some basic business interruption for nearly all of the clinics on island. And so what the governor did was set aside more than $7 million to push in, and we have a group right now that's working on a proposal that we feel would be able to, or at least the goal is to give some aid to stabilize their operations and that posture. And
Is that for all clinics, you said? Not just Tier 2s?
Well, and if you talk to the doctor, there's a lot of discussion in that realm. Yes, there's the Tier 2, but there's also Tier 3 facilities, clinics also. And that's something that is being reconciled right now, trying to come up with a good proposal. One of the proposals, for example, and one of the models that we tried to look at was a model based on Medicaid patients and the number of Medicaid and MIP. But some of these bigger clinics that are in Tier 2 do not accept or have very nominal Medicaid or MIP patients, and so that formula would not support them. There's another model, based on trying to do a per patient in clinic, but that also might be a little complicated. And then there's others based on, taking a look at what their GRT or revenue was last year, and trying for that to be used to figure out how to distribute and make available the funds. So I think that's kind of where we're at, is trying to, we have a group, and I'll get a report in the next few days on what the best, fairest approach is going to be.
Right.
Part of it is just like, one of the complications are, a lot of the patients that went to the clinics for their tests are all on private insurance and were billed to private insurance. So you can't, if it's going to be reimbursing on those, and they have to, it becomes an accounting thing also. So
LT, let me just start. Sorry, let me just cut in here. KUAM FM, I got Guam. It's containing COVID. Good morning to our viewers on TV 11 on the line. Lieutenant Governor Josh Tenorio, where we're discussing payments and possible CARES Act funds going towards local clinics. LT, in that story, something that we got late Friday we weren't able to include was they weren't necessarily a Tier 2, but there was a bunch of invoices that were paid out to HSP, Health Services of the Pacific. So when I was working on that Tier 2 story, some of the clinics were concerned that HSP was included in the superpowers route, and the I think it was the May 8th memos from the governor. So I FOIA'd Ed Byrne for any payments made using the Emergency Powers Act.
What I know that what I know is that HSP, they were providing medical staff at the quarantine sites, doing the evaluations of the incoming passengers.
Right.
Now, the contract aspects and all those nuances I'm not yet familiar with, but I can tell you that they came in. HSP does have public health contracts, but not for
Right.
pandemic at the time.
Right.
And so I know that they were secured to basically do the temperature checks and then also to facilitate if passengers had symptoms and then connect with public health on the testing.
Yeah, this was also one of those unsigned contracts.
Yeah. And I think that's where the tier twos are kind of scratching their heads, and that they've also provided a service. And I understand what you're saying on the timeline is HSP was on the quarantine facility, so it's kind of
they're
done, right?
stationary inside the hotels.
Right.
But the tent is there to try, and the way I see it is that they're because a lot of people also didn't go to the clinics. They were scared. Early on, people were told if you're sick, stay home, right, throughout the country.
Right.
And then when they could open, there's most are doing drive-through or telehealth, but I think that the patient revenues dropped because people were not going to the doctor.
Right.
And then you see a little of that now at the hospital when there's been, a bunch of non-COVID hospitalizations, likely resulting because people were scared or at home and they didn't want to come in. And that's something that I guess we've been seeing throughout the world.
Right, and I know that that's something Dr. Duenas had brought up, Dr. Vince Duenas had brought up in emails to the governor's office, saying that, we've been adversely affected by COVID. So I know you mentioned the CARES Act funding. He seemed to think that might be one way for these tier two clinics to get relief, would be to just, if you divvy up that $7 million or however you guys do.
I think that's the intent. Because it also is it's trying to make sure that these clinics and the medical staff are supported and ready in case something happens also. But they're also, some of them got the PPP, SBA loans, and in other criteria that's been used. I'm not sure if that's going to be factored in because in my mind, at least, I'm suggesting that it, be looked at, just try and take looking at it as trying to stabilize healthcare and making sure that we have parity and a good consensus behind how it gets distributed.
I wanted to
so
follow.
There is not consensus about it yet,
Right.
including among the clinics.
Mm-hmm. I wanted to follow up, and you probably already know this is coming, about the homeless shelter. We did a whole bunch of testing, the passport to services last week. They tested the homeless population, provided aid, conducted assessments, and I believe the question was asked of the governor, the status of the homeless shelter, and I believe she mentioned it was in they were accepting RFPs at the time. Is there any?
So we haven't.
Anything new?
I'm hopeful that we'll get a briefing about it this morning at our operations meeting. Chuck Esteves has been giving us reports, and so I know that GSA moved to the homeless shelter after they completed addressing all of the quarantine hotels last week or the last couple of weeks.
Okay, and speaking of the quarantine hotels, this is the second wave of procurement. What is your understanding of what exactly was the problem with Santa Fe that prompted the cancellation of that contract?
I think the National Guard went in and did an assessment, and I'm not sure what all of the issues are. I heard that part of it had to do with, making sure that each room had a phone, adequate phones, and there was a report that the passengers were having to leave their rooms and violate that provision because there were no phones for them to facilitate issues in their stay. That's the only detail I know about it. But I guess I'll find out from Civil Defense if there are other things, because I think that what was reported is that the Chief Procurement Officer and Civil Defense went up there to review the situation and are the ones that made the decision to depart from there.
Right. So it was the prior to the contract being signed. I understand that it's kind of like standard to go out and do a walkthrough of the facility, and so I guess I mean, they didn't go through every
Well,
single
you know,
room.
and the other, I think. Well, no, but I think maybe that when you go out and you have requirements and bidders agree to requirements, and then they just have to make sure that they follow what the conditions are of that award. But all the details I'm unsure about yet. I haven't seen the final report, but I'd have confidence that Claudia and Chuck made the best decision.
Right. And obviously one of the big questions of the day is is PUA and what happened over the weekend with the Department of Labor, because I know early in the morning I started getting messages, can we apply, check this out, can we apply? And I'm like, okay, we'll try and find out if this is actually legit, because when you go there is that option to apply. And so we later on got the message from DLL that it's just a soft launch. So yeah. I understand there's going to be a press conference today. Can you provide us any information on that?
I haven't gotten the update yet. I just know that a lot of the staff had been trained on the software, and over the week they were doing a lot of testing, identifying bugs for the vendor to resolve. And I'm hopeful that, based on the urgency to help people, that we can open this as soon as possible.
Right. What about the not SBA, but the GITA, their program that they've got going on and accepting of applications for the program that's going to be funded by the CARES Act?
The last Friday, Ricky had reported that there were more than 500 applications, I believe, submitted, and maybe 1,000 downloads of applications. So I think their review process is going, and I'll hear about it, in the next 30 minutes about how things are going, and hopefully when their first awards are going to be as well. A lot of their focus would be on the businesses that fell out of the eligibility or fell out of getting qualified for the SBA programs is part of it.
Okay. All right. Well, is there anything else? It sounds like you got to go to a briefing. Was there anything else that you wanted to say?
Well, no, I just wanted to, this is the rest of the employees of the government came into work today, and I just wanted to tell you that all the directors had been working and submitting plans addressing social distancing, and I just wanted to continue to ask people to remain safe. As you see in the other countries that have had success, there have been kinks or problems and other infections coming down, and if we want to make sure that we can try and advance our normalizing, we still need to recognize that there's a virus on this island, and that's a big threat to all of us, and I just encourage everybody to please continue to keep each other safe and to really understand, make notes where you're at. That would be helpful in the future if something were to happen and you've been exposed.
Okay. Well,
all right, and thank you for everything you're doing. I know that the role of the media is to provide a proper check and balance in addition to the other branches, and I just thank you for your work and continue to look forward to speaking with you.
Thank you for always answering our call.
Hopefully, I can be your first in studio whenever that is.
Yes.
Oh yeah, let's go. Sounds good. Thank you, LT.
Thanks. All right, thanks.
Okay.
Take care.
Wash your hands.
Bye-bye.
All right. Lieutenant Governor Josh Tenorio. Hey, we got to take a break. We're going to come back, do the anthems, do our news, and then we're going to break bread this morning with the new mayor-elect of the village of Jotnia. Yep. Okay. That's coming up here. Containing COVID, the KUAM News Takeover, Guam's favorite. Good morning.
Keeping you informed, KUAM News brings you